Hi, I'm Dr. David Hill, and today we're going to be talking about signs of anxiety in babies. Now, you might wonder, can babies get anxious? Absolutely they can. In fact, babies are deeply connected emotionally with their parents, especially with their mother, but with whoever tends to be the primary custodial parent if the mother is not that person. The baby's right brain, the part that processes emotions and feelings and understands kind of what's going around them and what's going on around them in an emotional sense, is growing tremendously rapidly, especially in that first year of life. And so babies are emotional sponges. If they detect a lot of anxiety from a parent, they're going to reflect back that anxiety. So what do we know? One of the most significant signs of really serious anxiety in a baby is failure to grow. And that's why we check babies' growth and development at regular intervals in the first year of life. Now in the United States, we see a baby a day or two after birth, at 2 weeks of life, at 2 months of life, 4 months, 6 months, at 9 months, and at 12 months, 15, 18, 24, and annually every year after that. Even if your baby's not getting shots. Some people say, well, why am I going to bring my baby in? You're going to give him shots. I don't want shots. That is something for you to talk to your baby's doctor about. But if you don't bring them in, you're going to miss that evaluation of growth and development. One of the things the provider is looking for is the baby's emotional development. How quickly does he or she smile and respond to your smile? Are they engaged? Are they making eye contact? Are they happy and playful and exploring their environment the way you'd expect them to? Any abnormality in those things may be a sign of anxiety. Another thing that we see is growth reduction in babies who are in very, very stressful environments. And we are talking about severely stressful environments, not mildly stressful like I was behind paying my credit card bill this month kind of environments, but environments where there's neglect, abuse, alcohol abuse, drug abuse, those sorts of places. Babies may stop eating, or they may stop growing very well even though they're eating okay. That's something that your baby's provider is going to be looking at with every wellness exam, and it's one of the things that he or she should be asking you about with every exam. How are things at home? Who's living there? Has anybody moved out? Are there any new stresses in your life? So we're going to be looking for those things as well. Now, if you start to read your baby's facial expressions, you can see signs of anxiety. They're expressions that you're familiar with. Do they look worried? Do the eyebrows come up together in the middle? Are they tense around the mouth? When you smile and look happy, do they reflect that back to you, or do they continue to have sort of a concerned expression? Those are things you can be on the lookout for. And if you start to feel like maybe your baby's not interacting with you in the way you would expect a healthy baby to do, again, bring that to a provider's attention and get somebody's opinion who looks at babies all day long, every day, and can put yours on the spectrum with all those other babies and say, yeah, you know what, this is normal, don't worry about it, or, I'm a little concerned, let's talk about this some more. Talking about how to recognize anxiety in your baby, I'm Dr. David Hill.